Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide brief remarks, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin today, I want to clarify a question that I've heard recently about getting tested before traveling. We know that some countries require proof of a negative COVID-19 test to allow people to enter, and Albertans can access testing for this purpose. Documentation of a negative test result can be obtained from My Health Record or for a small fee from Alberta Health Services. As we continue to see strong demand for testing, anyone Of course, this is not the only death that has happened in our province in the last 24 hours, and my sympathies go out to all those who have lost loved ones recently. COVID losses do, however, remind us of why we are living with public health measures. Another reminder of how serious COVID can be is the 45 people now in hospital, including 7 in intensive care. The other numbers being discussed publicly right now are cases in school-aged populations. I know that many Albertans still have concerns about schools. This anxiety is natural. Jurisdictions across Canada and around the world are facing the same challenges and uncertainties with schools as we are now. As I've mentioned before, there is no perfect path through this pandemic. Every option comes with its own risks. We must make choices based on the best information available at the time, monitor the information and the situation closely, and then adapt as needed to protect the health of our students, teachers, and staff. I know that many of you have questions. That is why we are holding these availabilities every day this week. I want to strive to answer any questions that you may have to the best of my ability. We are still learning about this virus, so I do not have all the answers, but I will always provide the information that I have and what we are doing to learn more. To date, AHS has confirmed 16 cases that were present at 16 different schools while infectious. I know that some have asked why we are focusing on that number when other sites are reporting higher numbers. The answer is that we are striving to help parents best understand the risk of exposure that their children face. I think it is important that I explain why I feel this is the correct approach. As a parent, learning that a teacher or other student who were never in the school while infectious and contracted COVID-19 at a party or while on vacation does not help me understand if my child is at risk. In a school context, there is risk for students and staff only when an infectious person has been present that they may have come in contact with. The best way to assess the safety of schools is to track and monitor the number of cases and schools where an infectious case was present, as well as schools where transmission has happened on that site. Other numbers are not relevant to school transmission risk and simply cause confusion and anxiety. To take an example from a different setting, if we reported every COVID case in any staff member who worked in a continuing care site, whether or not they attended work while infectious, there would be no benefit to the site or the public, and it would lead families of residents to be concerned that their loved ones were at risk when they were not in any danger. While we put precautions in place with single cases, we publicly report only when 2 or more cases are confirmed with transmission in the facility to provide this information when it is relevant. We have always committed to complete transparency to all those connected to a school when a case is identified. That is why mandatory notification is in place for all school cases. All parents, students, and staff who are part of a school community where an infectious case is identified have been receiving and will continue to receive an alert directly from the school whenever one of these situations is identified. There are times when a school sends out an alert before the public health investigation is complete, and so some of these alerts may in fact go out before we understand that there was no infectious case in the school. This can cause a discrepancy in our numbers. In addition to this commitment to transparency for those related to a school, we outlined several weeks ago a commitment to provide public reporting in a way that is similar to all other outbreaks, with a cutoff of 5 or more cases in a school. What we have heard over the past few days is that the public would be reassured by knowing that we are formally reporting even more than that. I have heard the desire for us to begin reporting outbreaks of even 2 cases, as well as alerts where schools have had a case present while infectious. We have committed to being responsive and adapting our return to school plan to meet students, parents, and teachers' needs. That is why today we are launching a new online map to help parents track where there may be a risk in their children's school. The map will list every school where there have been 2 or more cases in a school setting within a 14-day period, where disease could have been acquired or transmitted in the school. So far, none of the 16 schools that AHS has reported to us have met that threshold. If needed in the future, the map will also list schools that have shifted into scenario 2 or 3 to protect the health of students. I know there is interest in adding all school alerts with single cases to this public reporting as well. We are exploring ways to report all the schools where a single case has been identified who spent time in a school while infectious. We are working to understand the perspectives of school stakeholders on this, as it is important that we balance transparency and confidentiality, as we always do. I will update Albertans on this work in the coming days, and we are committed to continue improving the online map. This is a difficult time, and I know there are a diversity of perspectives that come from the same place, our shared concerns about the health of our children and colleagues. I would urge Albertans to remember that it is okay to disagree, but also remember that even well-meaning words and actions can impact the health and well-being of others. Focusing on the official numbers and situations where a risk of exposure has been identified is the best way to understand what is really happening in schools. I also want to highlight that as of today, Alberta has 1,585 active cases throughout the province. So far, the school cases identified have all come from community transmission, not through transmission within the schools themselves. As mentioned yesterday, the more cases we see in the community, the more likely we are to see COVID-19 in schools. I want to be clear, the continued rise in active cases in Alberta is something that we all need to be concerned about, and something that is within our power to stop. We all have the ability to take small actions every day that will benefit our schools and our communities. The small actions and the simple choices that each of us make are crucial to limiting the spread in schools and across communities in the days and weeks ahead. Thank you, and I'm happy to take any questions.
All right, we will go to the phone now. In addition to Dr. Hinshaw, we also have Andre Corbold, Deputy Minister with Alberta Education, to answer questions if needed. Operator, could you put through the first question, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. BC is forcing some businesses to close to curb the spread of COVID-19. In Alberta, we have a higher rate of case than they do. Are you considering similar measures to close some businesses?
We have been watching our case numbers closely over the past few months as we have had an increase in our daily case numbers to try to determine if it's clear that there are particular types of businesses where implementing additional restrictions could, in fact, reduce our daily case numbers. We have not found one particular type of business or location where we think that creating those additional restrictions would reduce our daily case numbers. Rather, it seems that the majority of our new cases are coming from close contact, potentially household transmission, social gatherings, or other type events that aren't necessarily easily controlled by formal public health restrictions and measures. I mentioned yesterday we have seen in the last several weeks a few outbreaks at religious gatherings, and I will be meeting with faith leaders to talk about the importance of the guidance that we have put out and making sure that they understand how critical each of those steps of the guidance is to make sure that their congregations, that their communities are protected. In addition, we are, again, continuing to look at our numbers and to try to understand if there is an additional formal restriction that is required. At this point, we haven't seen in our numbers the need to do any additional formal restrictions, but rather, again, encouraging Albertans to be following public health measures in all aspects of their lives, as that seems to be what's driving the majority of cases, are social interactions, household interactions, close contact interactions, where it really is outside of that formal business environment.
Operator, can you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Just a quick clarification about this map. Is it reporting 2 or more cases if they're individual cases or if they appear to be linked? And we've also seen some reporting delays with Alberta Health. So what's being done to ensure that this map is updated and as close to real time as possible? Now, my actual question for today is the province is ordering more doses of the flu vaccine this year, and seniors in continuing care will be offered a high-dose flu vaccine. What type of campaign is being planned to encourage more people to get the flu shot? Will there be more vaccination centres this year, and is the province hiring more staff to administer the doses?
I'll answer the clarification first and then the actual question. So the map is going to be providing information where there are 2 or more cases in a school environment where cases, again, have either both been infectious while in a school environment or if they are linked to transmission within that environment. So I want to be clear about an example where we would not put it on the map. So, for example, if you had a family that had 2 children that went to the same school, and one of those children became ill, and perhaps that individual had exposed or had been infectious at the school while they attended, but then they were kept home as well as their sibling, and their sibling developed COVID at a later point, we wouldn't necessarily consider that to be a school outbreak because the transmission event did not happen in the school, it happened in the home. Or if there are 2 cases, again, in a family where there was no exposure in the school, even if both of those cases attended the school, that's not a school outbreak. We're really focused on where is there risk within that school environment, because that's what's relevant, again, to be able to understand what kinds of measures we need to continue and what, if any, measures we may need to implement going forward that are additional to what we're currently doing. The influenza question, we have ordered additional doses of influenza vaccine this year to make sure that if we see an increased demand, as was seen in other countries like Australia, that we do have sufficient vaccine to accommodate that additional demand. The planning that goes on for influenza is one that's done with many partners, including Alberta Health Services. And Alberta Health Services does have the operational side of getting influenza vaccine out and available to Albertans. So specific questions about vaccination centres or staffing would best be addressed to AHS.
Operator, can you put through the next caller, please?
Next is Kendra Slugoski with Global Edmonton. Go ahead, Kendra.
Hi, Dr. Hinshaw. You increased the testing capacity by opening the Expo Center, so up to 5,000 swabs per day. Have you also increased staffing in the labs to make sure that these test results are coming back quickly? And what do you say to patients who say their results are taking too long to get back?
The delay time between when a sample is taken and when that a patient is notified is something that we are working very hard to shrink to make sure that people do get their test results in a more timely way. There are many different pieces of that process. As you mentioned, there has been a lot of work to ensure that the availability of people to take samples, whether that's in an AHS assessment centre or for those who have no symptoms and no exposure through a pharmacy. So that has been something that has been increased over the last several months. In addition, there's been quite a lot of work done on processes within the lab and how different pieces of work get done as a sample is processed. The data from that sample is entered into the lab system, and then the actual lab testing that happens. And Alberta Health Services is, I know, working to ensure that they have enough staff to be able to do all the different parts of that process in the lab. There's also been a lot of work done to make sure that the process, once the lab result is available, that staffing and measures to make sure that people get their results in a timely way and that contact tracing happens as quickly as possible. There's also been quite a lot of work to hire additional staff for that piece of it as well. So Alberta Health Services has been working and continues to work on all of those pieces to do the best that we can to make sure that people do get results quickly. Right now there is a delay, and that delay is concerning. And again, there's a lot of work happening to shrink that as quickly as possible on, again, all of those different pieces. So unfortunately, I don't have a firm deadline for when that turnaround time will be reduced, but many, many measures are underway to make sure that it's shortened as quickly as possible.
All right, operator, could you put through the next question, please?
Next is Shannon Scott with CBC. Go ahead, Shannon.
Oh, hi, Dr. Hinshaw. I just have a question about the notifications. You're saying that you're only going to be notifying when there are infectious cases in schools, but schools have been sending out these letters when perhaps there wasn't an infectious case in schools. Is something going to be done to try to streamline that, to keep the unsurety for parents in line?
I will just say that we are all learning, and that we in health and those in education are doing the best we can to provide information in a timely manner. So when schools receive a phone call from, for example, a teacher or a parent of a student saying that that individual has tested positive, right now I think schools are often erring on the side of caution and wanting to provide that information quickly to parents. And that's something that we are going to be working on over time. We know that parents do want information, and we want people to find out about cases in their school from a formal mechanism, not through social media. But at the same time, when that notification happens immediately, it doesn't always give time for Alberta Health Services to have actually done that investigation to determine if a case was present in the school while infectious or not. And so we are, as we always do, we work on, when these things pop up and we identify them as challenges, work on better processes so that we can strike that right balance of timely notification, perhaps then a secondary notification if investigation determines that there was no exposure in the school. But these are things that will take a little bit of time to implement, because I do understand that early notification can cause anxiety for parents, especially if that investigation determines that there were no exposures. So we're working on improving that process. And I would ask for patience at this time. Again, everyone's trying to do the best they can in a rapidly evolving situation.
Operator, can you put through the next question, please?
Next is Tyler Barra with CTV Lethbridge. Go ahead, Tyler.
Hi. I'm wondering, Lethbridge recently had a protest against the city's temporary mandatory face coverings bylaw. What is your message to those protesting against wearing a mask? As well, can you explain the science behind masks preventing the spread of COVID-19?
I know that there are those who are concerned about face coverings for various reasons. And again, as I said earlier, I think many people have different perspectives coming from what they believe to be best for their families and communities. And what I would say in terms of what information I've used to make my recommendations for face coverings, and in schools in particular, the requirement for face coverings in that setting is based on looking at the overall sum of evidence that's available from around the world. We, of course, don't have randomized controlled trials of community face coverings because COVID-19, while we have had about 6 months, we haven't, of course, had that time to set up a randomized controlled trial in a community to document where an intervention of face coverings is used and where it's not used, and to look at the difference. But what we do know is from experimental evidence looking at how face masks block the expulsion of droplets and infectious particles, and also looking at observational studies that have looked at the impact of face masks in different settings, and looking at the review of evidence around the potential harms of face mask wearing. There's very little evidence to demonstrate that there are harms to wearing face masks. And there is quite a lot of evidence, if you look at that overall collection of all the studies that have been done, to suggest that when someone wears a face mask, essentially the way that it works, if it's a medical face mask that has been standardized to provide the filtration that's appropriate, then that face mask can both protect the person wearing it as well as those around them, because it prevents particles from coming in while they're breathing in, as well as catching particles that they're breathing out. When you use non-medical face masks, whether that's cloth face coverings or other grades of face masks, it doesn't have the same degree of protection of the person wearing it, although there is some emerging evidence that would indicate that wearing those kinds of face masks may, if you're around someone who's infectious, may reduce the amount of infectious particles and potentially reduce the chances of having a severe illness if you are exposed to COVID. But the non-medical face masks are most important when someone is wearing it to protect those around them. And essentially what it does is it traps the particles so that those are less likely to be put out into the air and breathed in by the people around them. And it's really important when people are wearing masks that they look at the number of layers in a cloth mask. There's information on our website about how to choose masks. And so higher quality masks with more ability to filter will be better than those that are, say, just a single layer. But the importance, again, is that the more people who wear face masks, the more our community and those around us are protected, especially when we're not able to keep that 2 meters of distance from one another.
All right, operator, could you put through the next question, please?
Next is Eloise Rodriguez with Radio Canada. Go ahead, Eloise. Eloise, your line is open. Please check if your phone is on mute.
All right, we can come back to her if she is not available now. Operator, could you try?
Next question is Emily Mertz with Global News. Emily Mertz, go ahead, please.
Thank you. Dr. Hinshaw, you said yesterday that 2 of the deaths that were reported over the long weekend were in patients at care centers who were previously considered recovered. I'm just wondering if you can provide a little bit more clarity on that. Were they automatically put on the recovered list after that set period of time, after testing positive for COVID, or did their symptoms go away and then return? Did they test negative and then retest positive? Just wondering how that worked.
In those cases, those 2 individuals, their symptoms had improved and they were felt to have returned to what their baseline of health was, but then their symptoms reappeared, and the opinion of the physician in those cases was that the COVID infection had been a contributing factor in their death, and so that was the final consensus, I guess, or the final opinion, I should say, of the treating physician. It can sometimes be difficult to identify a single cause of death, but again, in the opinion of the individuals who were the treating and assessing physicians, they deemed that COVID had been a significant contributing factor, even though the initial infection had appeared to be resolved, but symptoms did then recur.
All right, we've got time for 2 more questions. Operator, could you put through the next caller, please?
Next is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, thank you. My question is for the Deputy Minister of Education. I'm wondering, now that there are kids at home in these 2-week chunks for self-isolation, what's happening to their education? What's the plan for them to learn while they're at home and while we expect this to continue to happen?
Yes, thank you for the question. The reentry plan does cause for school boards to be ready to provide online supports to students. We have several students that are at home. About over 100,000 students are at home because parents decided to be at home and have their students learning online. So school boards are prepared to provide those supports, and just as they would with any child who is sick and has to go home for a week or 2, they will provide those supports. Clearly there's more need for that with some of the self-isolation requirements, but school boards are providing those supports directly to families through various online means.
All right, operator, could you put through our final question, please?
Final question is Lauren Pullen with Global Calgary. Go ahead, Lauren.
Thank you. Hi, Dr. Hinshaw. We have received multiple videos and pictures into our newsroom inside Calgary high schools showing hallways during exit times, like lunch and after school, just packed with students shoulder to shoulder with no social distancing possible. I did show those videos and pictures to an infectious disease expert who said even though students are in masks, it is concerning. Asking if you've been made aware of these, what is your reaction to all of this if you haven't seen them yourself? And secondly, should we be seeing any changes to decongest the hallways?
Thank you for the question. I haven't seen those pictures myself. The reports that you're providing certainly are concerning if there's no distancing that's possible in crowded hallways. I think that this learning process of trying to figure out what works and what maybe needs to be adjusted is one that we will be in for the next several weeks at least, if not longer. And so I think that schools where they are seeing that kind of crowding in the hallways, again, masking does provide some benefit, but it's not the perfect protection. It should be an additional layer on top of other measures. And so I think that if there are schools that are experiencing those challenges, who can connect possibly with other schools that have found ways of addressing them to try to figure out if there's any possibility of staggered class times or other measures that might limit the crowding in the hallways, I think that would be optimal. Because, of course, even with masks, we do want to avoid a crowded, close environment. And so that's something that, again, would encourage those schools that are experiencing challenges to think of ways and to reach out to their colleagues to think of options that they can use to address those issues.
All right. Thank you for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a good day.